Welcome back to Rackspace's studio at TechCrunch Disrupt 2014. We're interviewing all sorts of cool startups, entrepreneurs, and other people who are walking the floor here. And today we have Drchrono. Drchrono is for doctor offices, healthcare systems, healthcare providers, and they are building for Google Glass and all sorts of stuff. So we're going to talk about that right now. So who are you?
I'm Daniel, Chief Operating Officer and co-founder of Drchrono.
Yeah, and what is Drchrono?
So Drchrono is a mobile medical records platform for physicians.
Okay.
Essentially, we're trying to bring the mobile experience to doctors. So whether it be iPad, MacBook Air, iPhone, even Google Glass. So like very lightweight tools that a doctor can use anywhere for their practice.
Most doctors are still on paper, right? I mean, they
That's
usually
correct.
have every time I go to my doctor, he brings a manila envelope with all my x-rays and blood tests and all that stuff, right?
That's correct. One thing we like to say is that we're competing with paper as a company. Yeah. So we always look at, is it faster for a doctor to write something down on an iPad, or is it faster for them to write something down on paper? Yeah. So every day we're competing with paper, and that's probably one of the biggest barriers for what we're trying to do in healthcare.
Yeah.
So
you do have some competition trying to do electronic health records, right?
That's correct. So there are a lot of people in this space, and there's a lot of people doing different things. So there's a lot of medical records companies specifically, and then there's other companies doing patient experience apps and things like Fitbit or Jawbone. It really depends on the company, but there is different variations on like healthcare type of companies. Some of them are in the larger hospitals, some of them are in smaller hospitals, some of them are only going for pharma.
Yeah. So who is this for?
So we, as a company, to date, we have close to 65,000 registered physicians.
Okay.
Last year we had around...
Now, is it the physician that buys it, or is it a group of physicians?
We're focusing more on the 1 to 50 doctor practice.
Got it.
So not the hospitals, but the smaller long tail of, you go to an urgent care clinic, or you go to a neurologist specialist who's outside of the hospital. So we're going after the physician who runs their own practice and wants to have software that's just as good as hospital grade software.
Okay, got it.
If not better.
So when you say mobile, you brought Google Glass in, you have an iPad, iPhone. What platforms are you on today?
So today our primary focus is iPad, iPhone, and web.
Yeah.
We just launched our Google Glass app, and that's really just for doctors. We call it a wearable health record. So a doctor can walk around and see micro bits of data while they're doing rounds. And it's a really great experience. So if you see a patient, you want to see, have they been here before? What drugs have they taken? I need to take a clinical photo. I want to take a video of this patient encounter to educate the patient to send them later. Yeah. So that's something that you can do on Glass. Meanwhile, the iPad and the iPhone are just so elegant in terms of if you want to e-prescribe a drug, right? You can do that very elegantly on an iPad within seconds.
So what are you showing me here? You have a Drchrono open here.
Sure, so this is actually our primary interface. This is where the staff members go and they do all of their work. Physicians go here also. And think of this as like a Google Calendar. This is the first thing you see. I need to schedule patients. Once you schedule a patient in, you can go in and list patients.
Yep.
Let me just show you. Here's one patient right here, so you can see their information and you can enter information about that patient right here. And really, this is primarily for staff members and physicians. Though the physicians primarily try to use this type of technology when they're doing their rounds, they can also use this as well.
Yeah. If I have 10 doctors in an office, how much would this cost to implement?
So we have a freemium model, so it can go from free to depending on what they want is paid. So the free plan provides an electronic health record platform for the doctor. And then we have upgraded services on top of that, like medical speech to text, advanced medical billing, advanced eligibility checking, things like that. So if a physician wants to, if a patient gives them an insurance card, half the time the staff member is calling saying, is this person actually, do they have this insurance, right? Yeah. Then they're saying, how much is the copay? How much is the deductible? So they're asking all of these questions. So things like that we bring into the paid plans. Just the medical records themselves are free. Yeah. But then, if they want support and things like that, it's additionally paid services.
Cool. What are you learning by building a company like this? What are you learning about a new customer base that traditionally hasn't had a computer hasn't traditionally been on the internet, hasn't traditionally, had to enter data like this? What are you learning from building a company like this?
I would say for us,
Yeah.
a lot of people say that doctors are adverse to this type of technology. I actually think that's the wrong thinking. I think that the technology is just it hasn't worked for them yet.
Yeah.
So we're looking at how do you give fast input on an iPad, right? A lot of consumption comes out of the iPad. You read a lot of things. How do you get a doctor to enter data really fast into this device?
Yeah.
And thinking about that, macro buttons, drawing on the iPad, medical speech to text, just simple ways that they could build things out and get that paper onto the iPad and make it faster than paper. And really that's what is sort of making the trajectory of our company grow very quickly.
Yeah.
Doctors are seeing this technology and essentially they're able to enter data faster. So if the technology is good enough, the doctors will use it. If it's not, they become very adverse very quickly because they're seeing 30 patients a day. They don't have time to, if something's not working immediately for them, they tend to shy away from that.
No, I get that. How are you guys funding this company, and where did you get the capital to grow?
Sure. So we were actually this year we were on the Inc. 500 as the fastest growing company. So we do have a user base of paying users that actually pays for everything. On top of that, we do have a number of investors to grow the company quicker. Yeah. So we have Yuri Milner, Paul Buchheit, right? We have
Started Friend Feet.
Yep. We have a bunch of other top tier investors who are basically just, they want to see this type of technology across the world, right? If you're in Switzerland and you're skiing and you hurt yourself, you want to just show your iPhone and say, here's my medical data. I'm allergic to this, this, this. These are the drugs that I've taken. These are the drugs that I'm allergic to.
That's an interesting point. Does the consumer have a Drchrono app on his phone or her phone? Or
we do.
So this isn't just for doctors. You get it from your doctor's office if they buy it, but then I have an app on my iPhone with all my medical records, or what?
That's correct. So to date, we have 3.7 million patients in the actual software today. And part of the reason why we started the company was frustration from ourselves in getting our own medical records. You call a doctor, they'll fax you a medical record, right? So what we do today is we allow patients to go in, see what they're actually paying for. We allow them to see other interesting information like labs, right? So is my cholesterol high? You can go in and actually pull that data up. I went to a doctor in a large hospital and he did blood work on me 5 months ago. I had to call him. I had to go in to get a piece of paper with my actual cholesterol levels on there. It's very frustrating. So for us, the patient experience is just as important as the doctor experience. The patients are paying the doctors. If they're happy, then the doctors are happy also, and then they just keep using the software.
No, it's a smart model. Do you? I theorize that you have a unique problem with HIPAA because of the regulations around sharing employee customer patient data.
Patient. Yep.
What's been your approach to that, and have you found it to be a problem, or is it easy to work around?
So HIPAA is just one of these things you just have to be careful about. There's no actual certification around HIPAA, but there are other certifications for this type of software. So we got something called Meaningful Use Certification, which allows other companies to come in, review the software that work directly with the government, that put a stamp of approval on this saying, this meets the guidelines to be a full-blown electronic health record for physicians and patients. Well,
that tells me sessions are starting. But thanks so much. Where do we learn more about it?
So you can go to drchrono.com.
And it's spelled a little bit unusual, right?
It's DRCHRONO.
Yep. Great name. Where did the name come from, by the way?
It actually means time. So originally it was just a piece of software for time. And then it sort of built into this whole platform.
Very cool. Thank you so much for coming in and showing it to me.
Thank you so much, Robert.
So we're doing more of these interviews shortly from TechCrunch Disrupt 2014 here at the Rackspace studio. Thank you for joining us and meeting some of these really crazy, great startups.